So we have this, and I said to someone earlier on, we have this sort of perfect storm evolving in the UK where we don't have enough of any workforce. We've got increasing demand in service. We run a 24/7 service, and actually we've always run a 24/7 service, but just at the weekends and in the evenings it's reduced, but it still exists, and actually people still have to work in those services. And what PA is doing is bringing in new people into healthcare. So we're taking biomedical graduate students in the main, and I think we graduate some between 16 and 18,000 of those per year in the UK, Adam. And we're taking those people who are smart, who have the academic capability of learning medicine in 2 years. And it isn't all of medicine we're trying to deliver either. It's the common and important things.
So I actually, in my final year of university, there was a teacher that was teaching hematology. And he mentioned in like one sentence in one of the lectures that he was a physician associate. And I was like, okay, what is that? Sleepy, confused, so I need to look sleepy. Confused, dry hair, hair loss, loss of outer third eyebrow, dry palms. Okay, so we'll do that?
Yep.
Cool.
Sounds good.
I'll go.
It's been a while now. I've just been feeling kind of low and just I don't understand what's happening to my body. I'm just not feeling well.
Mm-hmm. Okay. So how long has this been going on for?
I'd say
So we have a PBL, which is problem-based learning, once a week. So we get given a new case. So we spend about 2 hours discussing a clinical scenario, so a pretend patient. And then we have learning objectives that we go away and work on over the week.
Yeah.
So that's really helpful. I find that's like the best way to learn.
I agree, and coming back and discussing the learning objectives, and some people find something so interesting that you've missed, and it really aids your learning, talking through it all, doesn't it?
Yeah, because we all get different information, so it's so good having those few hours where we're discussing
and also that because some people actually have experiences, so they've seen, let's say if they've done nursing in the past and they've seen a patient like that, and when they tell stories, it retains mind a bit more, doesn't it?
Yeah. My work experience is actually mainly in Brazil.
Can you talk about Brazil?
It's very, very different. It's a lot more relaxed there. I was so surprised at how easily I got work experience. I just met a nurse and I told her, I would love to get some experience in the hospital. And she was like, okay, I'll call a doctor. She called a doctor and was like, I have a friend that wants to, go to the hospital. And he was like, yeah, just tell her to come in. So I went in to his office, I met him, he's a cardiologist. And he was like, I'm in on Thursdays and Fridays at this hospital. You can just come meet me and I'll show you around. And I had the most amazing time. I turned up every week for about 10 weeks. And he showed me everything. He introduced me to all the doctors in every kind of speciality. So I went through, nephrology, I did cardiology, acute medicine, surgery. But it's crazy because I just turned up and they let me see everything.
So I have to ask you this. Have you ever made yourself sick, Jessica?
No, I haven't.
Okay. That's great. And so you say you've gained a few pounds as well, is that right?
Yeah.
Okay. And this has this life event ever occurred before? Symptoms?
No.
Okay. So this is not trick. Hypothyroidism?
Yeah.
So hypothyroidism?
Yeah.
Oh, okay, cool.
Hey.
Okay. Awesome.
I absolutely love the feeling when you get a diagnosis right.
Oh, yes.
It's like, yes, it's something that's actually
Yeah.
Yes.
When you can answer the questions that your supervisor asks. I know that.
And they're like, well done. Yeah, once they're well done, it's like, you feel so elated.
It feels so good. But healthcare is very, very different in Brazil to how it is here. It's a lot. Obviously, they don't have the NHS, so it's a big struggle. Like you see a big separation with the rich and the poor, which you don't see here. Over here, you go into a hospital, a ward, and you can't tell what status somebody has. Over there, it's quite clear with what status they have.
How do you know?
Just depending. I'd say sometimes a lot of the doctors will treat patients differently because it is a lot about money over there as well. You'll see in their surround, like what ward they're put in, or whether they have a private room. A lot of the rooms are very kind of cramped together. It could be that it's the hospital that I was in as well, but yeah, you do see a big difference there. So that is something, coming here and having experience here, I've got a big admiration for UK healthcare system.